Gabapentin is a prescription medication primarily used to treat nerve pain, seizures, and certain types of anxiety disorders. While it can be an effective treatment for these conditions, it's important to be aware of the potential side effects associated with this drug. As an experienced writer, I'll provide you with a comprehensive overview of the common, serious, and long-term side effects of gabapentin, as well as strategies for managing and minimizing these side effects. Common side effects of gabapentin. One of the most common side effects of gabapentin is drowsiness or fatigue. Many patients report feeling unusually tired or sleepy after taking the medication, which can interfere with daily activities and productivity. Other common side effects include dizziness, headaches, and difficulty concentrating. Some patients also experience gastrointestinal issues, such as nausea, vomiting, constipation, diarrhea. These side effects are often mild and tend to subside as the body adjusts to the medication. However, if they persist or worsen, it's important to consult with your healthcare provider. Serious side effects of gabapentin. While the majority of gabapentin side effects are relatively mild, there are some more serious side effects that you should be aware of. These include respiratory depression. In rare cases, gabapentin can cause a slowing of the respiratory system, which can be life-threatening. This is more common in older adults or individuals with pre-existing respiratory conditions. Suicidal thoughts or behavior. Gabapentin, like many other anti-seizure medications, has been associated with an increased risk of suicidal thoughts and behavior. It's crucial to monitor your mental health closely while taking this medication and to report any concerning changes to your healthcare provider immediately. Allergic reactions. Some people may experience a severe allergic reaction to gabapentin, characterized by symptoms like hives, swelling, and difficulty breathing. This is a medical emergency that requires immediate treatment. Long-term effects of gabapentin use. Prolonged use of gabapentin can lead to several long-term effects, including dependence and withdrawal. Gabapentin can be habit-forming, and long-term use may lead to physical and psychological dependence. Suddenly stopping the medication can cause withdrawal symptoms, such as anxiety, insomnia, and seizures. Cognitive impairment. Chronic use of gabapentin has been associated with cognitive impairment, including difficulties with memory, attention, and problem-solving. Weight gain. Many patients report weight gain as a side effect of long-term gabapentin use, which can lead to other health issues. Increased risk of falls and fractures. Older adults taking gabapentin may have an increased risk of falls and related injuries, such as fractures. Managing and minimizing gabapentin side effects. To manage and minimize the side effects of gabapentin, there are several strategies you can employ. Start with a low dose. Your healthcare provider may recommend starting with a low dose of gabapentin and gradually increasing it over time to allow your body to adjust. Take the medication with food. Taking gabapentin with food can help reduce the risk of gastrointestinal side effects, such as nausea and vomiting. Avoid driving or operating heavy machinery. Due to the potential for drowsiness and dizziness, it's important to avoid activities that require your full attention and coordination while taking gabapentin. Stay hydrated. Drinking plenty of water can help alleviate some of the side effects, such as constipation. Engage in regular exercise. Regular physical activity can help manage weight gain and improve overall well-being. Monitor your mental health. Be vigilant for any changes in your mood or mental state, and report any concerns to your healthcare provider immediately. Precautions and warnings when taking gabapentin. Before starting gabapentin, it's crucial to inform your healthcare provider about your complete medical history, including any other medications you're currently taking. This is because gabapentin can interact with certain medications, potentially causing adverse effects. Additionally, gabapentin should be used with caution in the following situations: pregnancy or breastfeeding. Gabapentin may pose risks to the developing fetus or nursing infant, so it's important to discuss the potential risks and benefits with your healthcare provider. Kidney disease. Gabapentin is primarily eliminated through the kidneys, so dosage adjustments may be necessary for individuals with impaired kidney function. Older adults. Older adults may be more susceptible to the side effects of gabapentin, such as dizziness, drowsiness, and falls. Drug interactions with gabapentin. Gabapentin can interact with a variety of medications, including opioid painkillers. Combining gabapentin with opioid medications can increase the risk of respiratory depression and overdose. Antidepressants. Certain antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, may interact with gabapentin. Anti-seizure medications. Other anti-seizure drugs, like phenytoin or carbamazepine, can affect the way gabapentin is metabolized. It's crucial to inform your healthcare provider about all the medications you're taking, including over-the-counter drugs, supplements, and herbal remedies, to ensure safe and effective use of gabapentin. Gabapentin alternatives and natural remedies. If you're concerned about the potential side effects of gabapentin or are looking for alternative treatments, there are several options to consider. Anticonvulsant medications. Other anticonvulsant drugs, such as pregabalin or lamotrigine, may be effective alternatives to gabapentin for certain conditions. Antidepressants. Some antidepressants, like duloxetine or venlafaxine, have been used off-label to treat neuropathic pain and may be alternatives to gabapentin. Natural remedies. Supplements like alpha-lipoic acid, vitamin B12, and omega-3 fatty acids have been studied for their potential to alleviate neuropathic pain and may be worth discussing with your healthcare provider. It's important to note that any changes to your medication regimen should be discussed with your healthcare provider to ensure the safe and effective management of your condition. Seeking medical help for gabapentin side effects. If you experience any concerning side effects while taking gabapentin, it's crucial to seek medical attention immediately. Your healthcare provider can help you determine the best course of action, which may include adjusting the dosage, switching to an alternative medication, or discontinuing the use of gabapentin altogether. In the event of a severe allergic reaction or other life-threatening side effects, call emergency services or go to the nearest hospital emergency department right away. Conclusion: gabapentin can be an effective medication for the treatment of nerve pain, seizures, and certain anxiety disorders, but it's important to be aware of the potential side effects. By understanding the common, serious, and long-term side effects of gabapentin, as well as strategies for managing and minimizing these effects, you can make informed decisions about your treatment and work closely with your healthcare provider to ensure the safe and effective use of this medication. If you or a loved one are experiencing concerning side effects while taking gabapentin, don't hesitate to speak with your healthcare provider. They can help you explore alternative treatment options or provide guidance on managing the side effects. Your health and well-being are of the utmost importance, so don't be afraid to advocate for yourself and seek the support you need.